my group today. Okay, so let me just dive into this. I'm not going to go through all of these, obviously. A lot of these we've seen before. I just want to sort of share a couple of the main points here. And the point of the presentation, we've been, ONC and Whitney has been on this call, been on other calls over the last year or so, other ONC folks. We've been sort of synchronizing with them. And a lot of folks a number of the folks on this call are involved with some of the ONC initiatives. Year before last, we featured a lot of the accelerator sites, and a lot of the efforts between Gravity and Da Vinci and FAST and others, and the fire groups. So it's been an ongoing relationship with them. And so we had a chance yesterday to spend a little time and kind of just focus in on the consent piece. So long title, but we're really talking about, this project where we are currently focusing our efforts. We talked about, sort of the business case for consent. We talked about the context under which it's operating, which is the NIC, which is this group here, and where it came from over the last year with the national agenda that identified consent as one of the potential structural system level kind of changes. We talked about the consent utility, and I'll share a couple of pages on that. And then the immediate implementation opportunities, mostly through the Inc. sites, the New Jersey, New York, and Connecticut Inc. sites, but also others. We've been in conversation in other states as well as California and Arizona, to name a few. I spoke, Brian gave an overview, and then Dr. Coy talked a little bit about the Inc. sites, so it wasn't only me hogging the microphone. So we wanted to, I'll just spend a couple minutes here and then we'll move forward. And again, interrupt, put a question or comments into the chat if you want. We wanted to define sort of we call it a business case, but it's really kind of the imperative. So you can read that. The bottom line is, if there is a electronic tool out there that can do HIPAA, FERPA, 42 CFR, and the other consents, we haven't found it. So we don't think it exists anywhere. In fact, I'm pretty guaranteed that it doesn't exist anywhere. But people have different pieces of it, right? There's different pieces on the advanced directives that Chronic Care Partners was working on, some e-consent stuff, consent to share. Some of the, CRISP work was going on in that area, and New York is doing it, and Mayan is doing different pieces of it. So, without consent, and attorneys on the call, correct me if I'm wrong here, but with consent, we solve a lot of the problems, reduce a lot of the friction in terms of getting to sharing information. You need all the protections and all the information, the purpose and all those kinds of things, of course. But if you can actually easily make the transaction of providing consent to people in a form that they can use and understand, that has a potentially significant impact. And if it can be done in a replicable, customizable way by jurisdiction, then we avoid the recreation, let 1,000 flowers bloom, and everybody does it a different way. Hopefully with the standards that are being promulgated, we can do that. So we think we can make significant progress with the interoperability work, and especially in concert with what's going on at ONC. So obviously the goal is to make appropriate information accessible electronically when and where it's needed by creating a common interface to share PHI, PII. So the problem, that's the goal. A couple more pages I want to share with you. So we laid out their objectives here, really 4 objectives. One is we definitely want to build on the progress innovation from ONC and industry. So, let's just, this is the point of the scan we're doing, which is to take a point in time snapshot of where we're at. So your contributions to that will be are obviously critically important. Want to increase data liquidity to improve care coordination. This is, reducing friction. And it's important to, there's so much healthcare stuff going on always, and everything tends to get sucked into an EHR conversation. That we really want to represent the fact that a lot of the people who have been doing the work in NIC and are coming from the social services, the education, the justice side of things, public health side of things. And now is the time to make sure that we're making sure that whatever's getting built on the healthcare side can actually interface as seamlessly as possible. So we can really try to make some progress on social factors. We want to obviously implement this thing. I think that's one of the really important differentiators here. It's not just a set of recommendations. While it is that, and it is artifacts and implementation guides and stuff like that, but it's let's go do it in some places and let's do it in 21 and 22, not 5 years from now. This is going to take some funding though, right? And supports to make that happen. And that's what, part of our appeal to ONC was to say, how do you point us in the right direction? How do we partner? How do we sustain this work? There's a lot of people on this call and elsewhere who dedicated a lot of time. I think now with everything going on is the time to ramp up the efforts and see if we can make this happen sooner than later. So again, as part of the presentation, we showed our logo page. Apologies if folks are not on here that feel like they should be on here. We wanted to represent people who are kind of rolling up their sleeves. By all means, send me an email. We'll put you on here. You're not on here now. But it's impressive. People are coming to the table with a lot of different perspectives and knowledge and expertise. And that's what we really want to share. So we went through our usual background on why the NIC, cross-sector stuff, support from Kresge, the national agenda where we brought people together over the COVID year and identified consent as a really critically important piece. And then the other piece here, which we talked about a little bit, is the interoperability training program that we put together, again, with Kresge Foundation and our WJF support, which is really it's the organizational change effort. How do you create a common language? How do you help spread that across agencies and domains so that people have a common understanding of not only strengths and development areas, but a common language to do that. And we'll talk more about that, but I think the sustainability of this work means people have to be able to speak a common language. And that's one of the things we're trying to do. Brian talked about the vision. We talked about, Dr. McCoy talked about Inc. as a need to connect all the dots between these programs over the next couple of years. So we got runway, we've got funded sites that are doing the work and need to get the consent work done. We have a number of work groups. I'll pause just for a second on this that are part of Unify, right? The Unify is the larger initiative that's saying, how do you do interoperability? The consent work is sort of embedded in that as a very specific, tangible implementation piece. So these work groups are happening. Some are more happening than others, and we hope to sort of ramp them up, continue to ramp them up and deliver content materials. And here we shared, again, the teams, the 3 work teams that are working on the consent. I think this is, as of yesterday, at least, this represents, I believe, most of the people. Again, if you're not on here and you're doing work, I apologize. But again, it's a very, people are rolling up their sleeves, and it's an impressive group of folks to be able to work with. And we hope to be able to orchestrate it in a way that delivers content and value. So there's just a few more slides on the kind of what's next here. And so what we shared was we're doing a scan. That's what we're in the middle of. We're building on prior efforts. You can see from San Diego, from SAMHSA, from Rio, Chris, those guys. We're developing the requirements and blueprints for the implementation for Inc., and that would obviously be useful elsewhere. And we're looking for additional resources to support the continuing development, publishing roadmaps and stuff. And in fact, that was, well, I'll talk about that more in a bit in terms of what came out of the meeting yesterday. This is just sort of an expansion on the objectives I showed earlier. Want to build on promising practices. Second point here, the legal hurdles for data sharing. Critical point, how to do that. Work with counsel and privacy officers within the jurisdictions. See if there's anything I haven't spoken about. Obviously, leveraging open standards, open source, standards-based kind of API tools, and again, incorporate work from ONC, including the ones that are listed here, and others that we're discovering along the way. Oh, and we did speak with, oh gosh, I just spaced out her name, from Hart and Uma. I'm sorry, I forgot. Brian, do you remember her name? Anyway, they're going to be presenting some of the work that they've been doing as well as part of the ONC.
Right.
Right. And then, I think the imperative here is to do something now, right? We're at a historic moment in time, and if there's ever a moment ripe for change, we're here. And so we need to think big about that. Again, another visual of who the ecosystem is that we're trying to integrate, or at least present and involve and recognize who's doing work in a related field here. There may undoubtedly be others that are involved that we want to make sure we're paying attention to. Again, this is kind of the one of the points that we left the meeting with, which was our recommendations, was how to really take advantage of the momentum that's going on, and to work with ONC to help us understand what we don't know, right? We have to watch out for what we don't know, and hopefully everyone on this call and ONC, because they have a lot of visibility in other places, want to bring that visibility to this work. And so that is the conversation with ONC, where I think they've got a better, deeper understanding of what we're doing, who's involved, how we're moving forward. And they've expressed, interest in, sort of working alongside of us, making introductions already today. We had some introductions about the tech forum coming up and be able to sort of just demonstrate and discuss more of this. We'll talk about that over the next week or so, but it's a great partnership, and it's a particularly good one when we're talking to foundations for support and other state and local organizations. If you can really represent a collaborative, truly a collaborative spirit, which is the whole purpose of the NIC, which was the vision of it 4 years ago, was to get to this point, to be able to bring together the national, a national view of some of these problems. And here's a problem, and here's a team that can maybe make some progress on it in the near term. So, that's it. That's the discussion we had there. Let me just, before we pivot to the next topic, any comments? I'm going to open up the floor. Any comments or questions? And if not, I'm going to ask people to speak. So.
What's the next step, Daniel, in terms of moving this forward?
Yeah, so thanks, Matt. So the next step is for us to articulate this in ways that can be consumed by and sort of disseminated with and through ONC, I would say. They're going to have some conversations internally on how to interact with this group and in ways to actually do it within, federal agencies have, a lot of restrictions in what they can do and how they can behave, which is good. And also, just we have to be mindful of where and what they can do. But so there's a serious conversation happening. And as I said, there are some forums that are coming up. We've agreed to, they've, suggested some introductions to, there's a SDOH working group at the federal level. One of the things I didn't mention on the PowerPoint is this idea of a federal coordinating council, because I think ultimately for this work to really get done, like any state or any county, people only have a certain amount of authority in their silos. And so to cross those silos, you need a higher entity. So we're trying to push up to say, this really touches, not only ACF and CMS and FNS and CMI, but also, CDC is involved with stuff like this, and HRSA is involved with this, and then HUD is involved. And if there is some orchestration of that, and I know it takes a new administration a while to, get, really in the rhythm of it. But what I shared was when we worked for the first Obama administration, that actually started to happen, and it was incredibly powerful one. And that may already be happening. I don't want to suppose that it's not. There are probably lots of working groups that are happening and thinking about that. It's not a new idea. So the idea is to try to move it from a federal level, especially on some of the, some of the legal aspects. Can we create a safe zone basically to go do this work and indemnify folks who want to take the first step in a way? So it's open. The channels are open. The conversations available to be had.
My question for you, Daniel, and I'm sorry to be